Good evening, everyone. This is our first Tuesday class that will be held every Tuesday for 7 p.m. We will not have class on next week. We do not have class on the 4th of July. So we are closed. There is no school on the 4th of July, but we will have our regular scheduled meeting on that Thursday. So I wanted to start having an additional class. All of the instructors are going to be having like 2 full classes, especially when it comes to coding, to get you all familiar, and especially with ICD coding, which is outpatient. I know a lot of people like to work in outpatient clinics. So this is very, very important for you all to understand what goes on and how to code accurately. I'm going to share my screen a little bit because I did put in place a cheat sheet. It's in your e-learning of ICD-10, and I'm going to share my screen with you all. First, we're going to go through some important information as far as the chapter. So if you have your books, we're in chapter 5. Specific guidelines, and this is going to cover chapters 1 through 10, where you will have these specific guidelines. And this is in your step-by-step medical coding book. So we're going to go through just a few because we need to go really in detail with these with chapter 5 specific guidelines. So it says certain infectious and parasitic diseases, neoplasms. Do anybody remember what neoplasms are?
Cancer.
Correct, cancer. Diseases of the blood and blood-forming organs, and certain disorders involving the immune mechanism. So these are the objectives we're going to cover in this class today. So your learning objectives for chapter 5 is, like I said, review certain infectious and parasitic disease codes, analyze neoplasm codes, and assess the blood and blood-forming organisms. So I want you all to really read this chapter in its entirety along with your PowerPoint slides. But for this chapter, the PowerPoint slides are helpful, but to get more information, you need to read this chapter. Certain infectious and parasitic diseases. So in chapter 1, in your ICD-10, if you have your book, I'm getting mine out. If you have your ICD-10 book, and if you look in chapter 1, in your book, in your ICD-10, chapter 1, it will tell you certain infectious and parasitic diseases. And that will go from A00 through B99. So certain infectious and parasitic diseases is in chapter 1, and it goes from A00 through B99. U07.1, which classifies diseases according to the etiology, which is the cause of the disease, because infectious and parasitic conditions can affect various parts of the body. The chapter contains a wide variety of codes and complex terminology. So like I stated once before, when you look into that chart, a lot of the words are not going to be spelled out. They're going to have abbreviations, acronyms. So it's important to know your medical terminology. It says in this chapter, there are many instances of combination coding and multiple coding. Remember, combination coding is when one code fully describes the conditions and/or manifestations. Highlight this if you can. This is on your chapter 5 exam. Combination coding is when one code fully describes the conditions and/or manifestations. Multiple coding is when it takes more than one code to fully describe the condition, circumstances, or manifestation. And then sequencing of multiple codes is considered. So these are some good examples they have in a book to explain how it works and how it's broken down for you to be able to know how to find the code. So these are some examples of combination coding. So the diagnosis is candidiasis. That's infection of the mouth. So in the index, you're going to look in your index first. Remember, you always look in the index first. You never just go straight to the tabular. Once you become an expert and you're really good, you might be able to use just a tabular. But for right now, you always look in the index, never code directly from the index. You look in the index and then you get a confirmation in the tabular. So in the index, candidiasis, it says candidal mouth B37.0. Then you're going to go to the tabular and it says B37.0 candidal stomatitis. Code B37.0 candidiasis infection of the mouth. B37.0 fully describes the diagnosis. It tells you right here the diagnosis and is candidiasis infection of the mouth. So when you go to the index, it's showing you. Then when you go to the tabular, it's telling you. And then the code, candidiasis infection of the mouth. So you would only use the B37.0, which fully describes the diagnosis. Multiple coding example. Urinary tract infection due to Escherichia coli, which is E. coli. The index, when you go to the index, it's going to state infection, infected, infective urinary tract, which is going to show you NEC, which is N39.0. So in the tabular, when you look it up, it's going to say N39.0, urinary tract infection, site not specified. And then it tells you use additional code, B95 through B97, to identify the infectious agent. So it says code N39.0 does not fully describe the condition. The instructions in the tabular for code N39.0 state that you are to also code the organism causing the urinary tract infection. To locate a causative organism, you locate the main term. So that main term is infection in the index, and then the subterm of bacterial, followed by the subterm as cause of disease, classified elsewhere, and then the specific organism, which is the example of E. coli. Any questions? And does everybody understand why it was not just N39.0? And if you look back at the diagnosis, it says urinary tract infection due to E. coli. When you went in the index, it said infection, infected, infective urinary tract, but it's not stating the cause. What was the cause? It was due to E. coli. So you always code to the fullest extent. Here is another one. Index, infection. When you look in the index, bacterial as cause of disease classified elsewhere. E. coli says see also. So every time when you look at a book, you always want to look at the notations, the message, the notes that is stating. So it says see also Escherichia coli, B96.20. And the tabular, B96, it says other bacterial agents as the cause of disease classified elsewhere. B96.20, E. coli as the cause of disease classified elsewhere. The urinary tract infection is sequenced first, followed by the bacterial organism. Code N39.0, B96.20. Urinary tract infection due to E. coli. Does everybody understand that part? And it says here, multiple coding is necessary to fully describe the infection of the urinary tract and the causative organism. So you're not just going to code for urinary tract. What was the cause of it? E. coli. So you have to code all the way to the fullest extent and the highest extent. Any questions for this part? Does everybody understand so far? If you do not understand, please let me know. This is the only way you're going to be able to learn, because we're going to do some coding today. I noticed on your exam, for the last exam, I don't know what went on, but basically everybody had high scores. And remember, getting the answers out of the back of the book is not going to help when it comes time to getting a job. A lot of time for billing and coding, you have to take a test because they want to make sure you know how to find the actual code, because this can cost you with keeping a job or being terminated for a job if they're not being paid, if they're not being funded, or if you're not coding correctly and they're losing money. So I found it very, very strange that everybody had, not everybody, majority of you all had high scores when we hadn't really been doing any coding. So remember, the answers in the back of the book is a guide for you to look in the back of the book and get the answer once you try to find your answer first, and then do a comparison to see if you're going in the right direction. Not to use it because it's not going to benefit you when it comes time to your national certification exam. So use the back as a guide, not to get your answers, because it's really not going to help you any. Next, we have resistant infections. Section 1C. If you look in your tabular, in your index at the front of the book, you have sections. Section 1C is infections resistant to antibiotics. A lot of times you might have an infection and it's not working because it's resistant to the antibiotic the doctor has prescribed. So this is the chapter-specific coding guidelines in section 1C, infections resistant to antibiotics. Many bacterial infections are resistant to current antibiotics. It is necessary to identify all infections documented as antibiotic resistant. Assign a code from category Z16. Resistance to antimicrobial drugs. Following the infection code only if the infection code does not identify drug resistance. So here we have A codes, A00 through A99. This is really going to help you all when it comes to coding. They said the A codes include the blocks illustrated. So in figure 1, it has all of your A codes. So if it's something intestinal infectious disease, it's going to be in A00 through A09. Tuberculosis, A15 through A19. This is in your ICD-10 book. This is what's located in A00 through A99. And I also provided you all with a cheat sheet. We're going to look at that in a minute too. That will be able to help you all with understanding where to look for the codes. Antibiotics are used to kill the bacteria that cause disease, but many antibiotics that were historically effective against bacteria are no longer effective. Most bacteria have become resistant to some antibiotics, but other bacteria are resistant to many antibiotics. Multi-resistant organisms, which are MROs, are superbugs. Those antibiotics that have been widely prescribed are no longer effective. For example, methicillin resistant to Staphylococcus aureus, which is called MRSA. I know plenty of you, like a lot of times they say that a lot of people would get MRSA when they would be in hospitals, and they would get MRSA, which has really, I mean, killed a lot of people in different hospitals, MRSA. It's a multi-drug resistant Mycobacterium tuberculosis, MDR-TB, and vancomycin resistant Enterococcus, VRE, penicillin resistant Streptococcus pneumonia has also increased worldwide. When reporting an infection that is antibiotic resistant, report the infection first, followed by Z16. Infection with drug-resistant microorganisms. So it tells you when reporting an infection that is antibiotic resistant, report the infection first, and it's going to be followed by Z16. Infection with drug-resistant microorganisms. This is the mechanism by which drug-resistant microorganisms are tracked. Staphylococcus aureus is the exception to the Z16 rule. So you all know that's going to be on your test. What is the exception to the Z16 rule? Staphylococcus aureus is the exception to the Z16 rule. For Staphylococcus aureus, specific codes designate the status of resistance to methicillin. B95.61, methicillin susceptible Staphylococcus aureus, infection as the cause of disease classified elsewhere. When you look in your book in the first chapter, this will explain. So if you have your book, look at B95. And it tells you exclude, so you make sure you have to read your notes, read everything that it tells you. B95.62. And it has on there the RSV and all of the different codes for you. So quick check 5-1. This is how you'll get some extra points. Everyone will receive 5 points for this class plus additional points if you're participating. Remember, these points go towards your grade. It will help you for your exam, for assignments. Please make sure that you keep track of your points. And when you would like to use your points, just email me, text me, or give me a call, and I will apply those points to where you see and need necessary. So quick check 1. And remember, when you have your questions, the answers are always going to be prior to the questions. So it's not going to be you have quick check 5-1 here, and then it's going to be in another chapter. It's always going to be prior because it's just a refresher of what you have just read. And it's to make sure that you're having an understanding of it. So it says, number 1, what category code would you reference when reporting MRSA? So that is something we just went over. So can someone answer for me?
Z16.
Does everyone agree with that?
What did she said B16?
No, I said Z.
Z
Z as in zebra. Okay.
Oh, okay. I'm sorry. I don't know why I
It's
heard
okay.
B.
Does everyone agree with that?
So you can go back and listen to it.
Should I go back up or does everyone?
I guess so, because go back. Yeah.
Everyone agrees with Z16?
Yeah. Yes.
Okay, that is correct. What is the drug resistance in VRE?
Vancomycin.
Let's go back. So what is the drug resistant to VRE?
The vancomycin.
Penicillin.
Or penicillin.
It's the vacuumycin.
Vancomycin
Yeah,
is
vancomycin.
resistant.
Vancomycin.
So this is what I'm saying. So when we're doing these quick checks, the information is prior to what we're reading. So that means that you have to really pay attention and make sure you're understanding what you're reading. So vancomycin is the drug. What is the drug resistance in VRE? Vancomycin. What does the S stand for in MRSA?
I can't pronounce it.
Staphylococcus.
Yeah.
Yes, that is correct.
It's not long word. That's all I know.
Staphylococcus. Yes.
Staphylococcus. Yeah.
So that is correct. So remember, whenever you're reading and when you're doing your daily assignments or your labs, make sure that you reference and that you're paying attention and you just go back and read prior. They're never going to give you something that's in another chapter or whatever. It's always prior to what you have read. Sepsis, severe sepsis, and septic shock. Very, very important to know. Sepsis is an inflammatory condition in response to microorganisms in the tissue, blood, lungs, skin, or urinary system. SIRS, SIRS, systemic inflammatory response syndrome. Is diagnosed when two or more of the following are present: hypothermia, tachycardia, increased respiratory rate greater than 20 breaths per minute, increased or decreased white blood count, less than 4,000 or greater than 12,000. So this is for sepsis. Then we have severe sepsis, represents a systemic response to organ dysfunction, hypotension. So what does hypotension mean? Hypo means what?
That's high.
No, hypo.
Hypo. Oh, hyper. That's low, right?
Right. Hypotension is low blood pressure. Hypertension
yeah.
is high blood pressure. So it says severe sepsis represents a systemic response to organ dysfunction, hypotension, or collection of fluids in the tissues. Hypoperfusion. To report severe sepsis, you would report a code from subcategory R65.2. But remember that severe sepsis can only be reported if severe sepsis is documented in the patient health record. So if you do not have that documented in that health record, you cannot report it. So that's why it's so important to read that patient's health record when it comes time to do the billing for it and coding. If it's not in that chart, you cannot report it. The provider will make the diagnosis of SIRS. If the documentation indicates organ dysfunction, if the documentation indicates organ dysfunction and the organ dysfunction is related to a condition other than SIRS, severe sepsis is not reported. There must be a documented correlation between the SIRS and the organ dysfunction to report severe sepsis. It will require at least 3 codes to report severe sepsis. And let me tell you why this is so important. Because the doctors get paid a lot of money for severe sepsis. So when it comes time to auditing, they're going to look through that chart very, very thorough to see if everything was documented for you all to be billing and coding severe sepsis. It will, and that's why it will require at least 3 codes to report severe sepsis: a code for the underlying systemic infection, a code from subcategory R65.2, and a code or codes to report organ dysfunction. If you do not have those 3 codes, you will not be reimbursed. When the microorganism is not documented, report A41.9, sepsis unspecified. Septic shock is a circulatory failure that represents a type of organ dysfunction. Report the underlying infection first, followed by R65.21. Severe sepsis with septic shock and codes from any organ dysfunction documented in the health record. Code R65.21 is never assigned as the first listed diagnosis because it is a result of an underlying infection. Therefore, trying to see another part I was going to read that was very important for you all. Therefore, the infection is the first listed diagnosis followed by the severe sepsis. So remember, never code severe sepsis without 3 codes, never. In section 1C and 1D, sepsis, severe sepsis, and septic shock. Septic shock, it tells you the definitions for each one. Generally refers to circulatory failure associated with severe sepsis, and therefore it represents a type of acute organ dysfunction. For cases of septic shock, the code for the systemic infection should be sequenced first, followed by code R65.21, severe sepsis with septic shock, or code T81.12. And when you're looking at it, they're going to have that information for you. So don't get scared when you're seeing all these different codes. It's going to be there, and you'll just have to follow the directions or what it's telling you. Post-procedural septic shock, any additional codes for the other acute organ dysfunction should also be assigned. As noted in the sequencing instructions in the tabular list, the code for septic shock cannot be assigned as a principal diagnosis. Sequences of severe sepsis. This is what you all need to review because this is very, very important when it comes to coding as far as reimbursement and coding. If severe sepsis is present on admission and meets the definition of principal diagnosis, the underlying systemic infection should be assigned as principal diagnosis, followed by the appropriate code from subcategory R65.2 as required by the sequencing rule in the tabular list. A code from subcategory R65.2 can never be assigned as a principal diagnosis. So remember, R65.2, when you see that, can never be assigned as a principal diagnosis. When severe sepsis develops during an encounter, it was not present on admission. The underlying systemic function and the appropriate code from subcategory R65.2 should be assigned as secondary diagnosis. SIRS may develop as a result of a procedure and becomes a complication of the medical care the patient received. So usually, just like with MRSA and SIRS, they get this and they contract this when they're in the hospital. And this has happened quite often in hospital settings. If these instances report a post-procedural infection first, followed by a code for the specific infection. We're going to go through just one of these examples. Subcategory T80.2. Infections following infusion, transfusion, or therapeutic injection. Report an additional code to identify the specific infection, such as sepsis. All of this occurred after a procedure was done. And this usually happens when the equipment is not cleaned thoroughly. Something happens. This happens in the hospital setting most times. Coding for sepsis, severe sepsis, and septic shock. For a diagnosis of sepsis, assign the appropriate code for the underlying systemic infection. So always read through this. We're going to do some examples. So we definitely need to know this on this exam, the Zika virus infection, section 1C, code only confirmed cases. Code only a confirmed diagnosis of Zika virus, A92.5, Zika virus disease, as documented by the provider. This is an exception to the hospital inpatient guidelines, section 2H. In this context, confirmation does not require documentation of the type of test performed. The provider's diagnostic statement that the condition is confirmed is sufficient. This code should be assigned regardless of the stated mode of transmission. If the provider documents suspected, possible, or probable Zika, do not assign code 892.5. So remember, with the Zika virus, you only code a confirmed case. Do not assign any other code if it says, if it's suspected, possible, or probable. Do not assign code 892.5. Assign code explaining the reason for encounter, such as fever, rash, or joint pain. So let's do this toolbox 5.1. Robert has sepsis resulting from a post-procedural infection that is now complicating his care. Question. Sepsis resulting from a post-procedural infection is considered a, if you have your books, I need you all to find me that answer. Sepsis resulting from a post-procedural infection is considered a what? Go back and read. We went over that.
Is it the SIRS?
Not SIRS. It states sepsis resulting from a post-procedural infection is considered a and if we go back to sepsis,
An inflammatory condition? An inflammatory condition?
not inflammatory, so go back to sepsis, the first part of sepsis. And then also in here, we go back to sepsis. So that answer would be complications. Complications. As with all post-procedural complications, code assignment is based on the provider's documentation of the relationship between the infection and the procedure. And it states here, sepsis resulting from a post-procedural infection is considered a complication. Number 2, if the documentation stated that Robert's sepsis was severe, you would reference what subcategory for code assignment? What subcategory would you reference for code assignment?
R65.2.
Yes, and if you look back up here, they had it here, but if you read further, therefore, when a non-infectious condition leads to an infection resulting in severe sepsis, assign the appropriate code from subcategory R65.2, severe sepsis. Number 3, when reporting severe sepsis, you would also report what dysfunction?
Any acute organ dysfunctions?
Correct. That is correct. Organ dysfunction. We all know about this section, coronavirus infections. This was a new code that was added 2.5 years ago. Section 1C, chapter specific coding guidelines. 1G, coronavirus infections. COVID-19 infection, infection due to SARS. Code only confirmed cases. For coronavirus infections, you're coding only confirmed cases. Code only a confirmed diagnosis of the 2019 novel coronavirus disease, COVID-19, as documented by the provider or documentation of a positive COVID-19 test result. For a confirmed diagnosis, assign code U07.1. For a confirmed diagnosis, assign code U07.1, COVID-19. This is an exception to the hospital inpatient guideline, section 2H. In this context, confirmation does not require documentation of a positive test result for COVID-19. The provider's documentation that the individual has COVID-19 is sufficient. So remember, inpatient is coded different from outpatient. So it says this is an exception to the hospital inpatient guideline, which is section 2H. In that section, confirmation does not require documentation of a positive test result for COVID-19. The provider's documentation that the individual has COVID-19 is sufficient. So things are different with outpatient and inpatient. Inpatient is once you're in the hospital. Outpatient is you're going in and you're leaving. If the provider documents suspected, possible, or probable, or inconclusive COVID-19, do not assign code U07.1. Instead, code the signs and symptoms reported. And it'll tell you, see guidelines 1C, 1G, and 1G. Sequencing of codes for COVID-19. When COVID-19 meets the definition of principal diagnosis, code U07.1. COVID-19 should be sequenced first, followed by the appropriate codes for associated manifestation, except when another guideline requires that certain codes be sequenced first, such as obstetrics, sepsis, or transplant complications. Acute respiratory manifestations of COVID-19. When the reason for the encounter, admission is a respiratory manifestation of COVID-19, assign code U07.1 COVID-19 as the principal first listed diagnosis and assign codes for the respiratory manifestation as additional diagnosis. If it's non-respiratory manifestations of COVID-19, it says when the reason for the encounter admission is a non-respiratory manifestation, example, viral enteritis of COVID-19, assign code U07.1 COVID-19 as the principal first listed diagnosis and assign codes for the manifestation as additional diagnosis. So it's coded different for exposure to COVID-19. If you've been exposed. For asymptomatic individuals with actual or suspected exposure to COVID-19, assign code Z20.822. Contact with and suspected exposure to COVID-19. A lot of people was getting this. They were exposed. And they would ask you when you go to the doctor, have you been exposed to anyone or traveling overseas? This is the code that they would use. For asymptomatic individuals with actual or suspected exposure to COVID-19 and the infection has been ruled out or test results are inconclusive or unknown, assign code Z20.822. Contact with and suspected exposure to COVID-19, and it'll tell you what guidelines. Contact exposure for additional guidance regarding the use of category Z20 codes. If COVID-19 is confirmed, then they have the different screenings. During the COVID-19 pandemic, a screening code is generally not appropriate. Do not assign code Z11.52 encounter for screening for COVID-19. for encounters for COVID-19 testing, including preoperative testing, code as exposure to COVID-19. Coding guidance will be updated as new information concerning any changes in the pandemic status becomes available. So a lot of codes have changed due to their saying that is another variants and different things are going on. So once you get into that workplace, you're going to have additional codes to use for coronavirus or COVID or the new variants that's going on now. Signs and symptoms without definitive diagnosis. For patients presenting with any signs, symptoms associated with COVID-19, such as fever, etc., but a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms, such as acute cough, cough unspecified. That would be RO 5.1, acute cough, RO 5.9, cough unspecified. Shortness of breath, 06, fever unspecified, 50. If a patient with signs and symptoms associated with COVID-19 also has an actual or suspected contact with or exposure to COVID-19, assign Z20.822, contact with and suspected exposure to COVID-19 as an additional code. So read on that, the personal history of COVID-19, follow-up visits, the definitions and what it means for those examples. And then we have the B codes. So we're going to stop here because I'm going to share my screen now again with some information in your in the grace section that I want you all to look at. So in your grace section of e-learning, I put some additional coding tips in here. So in your grace section, I have ICD-10 coding tips, Chapter 3 coding info, your ICD-10 NCCT packet with answers. This is questions and answers that will be on your certification exam. Your ICD-10 cheat sheet, medical coding. This is what I want you all to look at. This is very helpful. This is a chapter sheet, cheat sheet. So it helps you. It says the chapter number, letters associated with the chapter. So in chapter 1, it's A through B, and it's a chapter title and code range. Certain infectious and parasitic diseases, which we were going through, A00 through B99, which is also in your textbook. And it states to help you know where to look, antibiotics. So it's giving you it's a little cheat sheet to help you know where to look. So chapter 2, letters associated with chapter 2, C and D, neoplasms, COO to D49. So in this chapter, it's going to be cancer and death. So, you know, anything dealing with cancer is going to be in neoplasms, and you would find that information in chapter 2. Chapter 3 is D, diseases of the blood and blood-forming organs and certain disorders involving the immune mechanisms. So this is an example they gave to help you understand. Dracula, same blood, you know, to help you remember some key terms. And then this one here, I'll stop at E. Chapter 4 is E, endocrine, nutritional, and metabolic diseases. And the example is endocrine. So this is a cheat sheet that would help you and tell you what to look for when you're trying to find these codes. Very, very helpful information. This is also, like I said, this is in your e-learning. The next thing that I have that is really helpful for you, steps for accurate coding. Steps for accurate coding. It's telling you how to code accurately. Identify the main terms or keywords. Locate the main term in the alphabetic index. Review the subterms under the main terms in the index. Follow and cross-reference instructions such as C. When they tell you, they're going to tell you what to do. C also, C condition. Verify the code selected from the index in the tabular. Refer to any instructional notations in the tabular. Assign codes to the highest level of specificity. This is what you all are doing now. You have to code to the highest level. You don't just stop at that first one, you code into the highest level. Code the diagnosis until all elements are completely identified. So this is also in your grade section of e-learning. So I've given you a lot of information. I put this in last night, ICD-10 Chapter 5 Specific Guidelines, coding with blue. She goes through it step by step as well, giving you examples on how to find the codes. I also put it in your daily assignment. So please make sure to reference this video. It is very helpful as well. When you look at your PowerPoint slides, human immunodeficiency. B20 reports HIV infection and includes AIDS. Positive serology or culture, but no symptoms report. Remember, always B20. So I'm gonna start right here. So we went through this, certain infectious and parasitic diseases. Like I said, it's good to still read your chapter because this is not gonna go too much in detail. But remember, AOO through B95 is in chapter 1, classified according to etiology, cause of the disease. Combination coding equals one code to fully describe the disease. Multiple coding, 2 or more to fully describe the disease. And if you all look at the bottom of your notes, it gives you some more information. It says in this chapter, there are many instances of multiple coding and combination coding. How are these codes divided? Mainly by the etiology or cause of disease. What type of infection is Candidus? It's a fungal infection. So all of it explains, but it's still important to read in your chapter. Resistant infection and sepsis, we went through that. The first listed diagnosis would be infection. Sepsis, this tells you how to do it. Septicemia. If unknown organism, it tells you what to report first. Codes for special purposes. All of this is important to know. U07.1 is COVID-19. This is on your exam. What code would you use for COVID-19? Vaping related disorder. What code would you use? It's still U07.0. U09.9, post-COVID-19 condition, unspecified, not reported with active COVID-19. Code first, the specific condition related to COVID-19. Human immunodeficiency, B20. This is on your exam. B20 reports HIV infection and includes AIDS. Positive serology or culture, but no symptoms report. Z21, asymptomatic HIV status. HIV exposure, but no positive serology report. Z20.6, contact exposure to HIV. Inconclusive serology, R75, used for newborns of AIDS mothers. So they have all of the different parts for HIV testing. This is in your PowerPoint slides as well as in your chapter. Remember, neoplasms is chapter 2. So we're going to stop here and I'm going to stop sharing my screen. And I need to take a picture so I can write down everybody who's on here so I can give you your points for today. If you can you all, if you are able to turn your cameras on so I can see your faces, please?
My camera isn't coming on. I keep pressing it, but it's not working.
Okay, that's fine. For those of you who can you turn on your cameras? So that I can make sure that I give you all your points, and remember to give me a call when you want to use your points, or if you want to apply it to an exam, if you want to apply it to a daily assignment or a lab. Give me a call and let me know. Remember, you will be marked present for attendance as well for logging on to your live Zoom class. So now it's time for questions. I did assign you all and I placed you all in groups last night. So please make sure that you get in contact with your classmates. The email is in the message that I sent you. It should be 4 to 5 in a group. You all can do your daily assignments with your group. You can do your group assignments together. But do remember that you all are great. You can assign one person to do it. You know, y'all can take turns with assigning, or you all can do it together and post it in your assignments. But this is going to help you all when you're working with, you know, in your area, in your career, because you will be doing group things when you all are billing and coding, you know, comparing or whatever to help and assist you. So please remember, if someone is not doing their part or if they're not responding, please let me know, because this is a group assignment. You all should be working together.
You say
One
you
person-
already sent it?
I'm sorry, I didn't hear you.
You say you already sent it to our email?
Yes, I sent it last night.
Okay.
So make sure that you all are checking. I sent it out to everyone last night. And everybody should have 4 to 5 people in their group. So please stay in contact. This is how you form, you know, relationships as well. And like I said, one of your classmates might be able to explain something more than in detail than what I'm doing. Sometimes you learn better from your classmates. Watch the videos. I mean, if you want to do a one-on-one session, remember to contact me. We can do one-on-one coding class as well. Any questions?
For emails or in our.
I sent it to in the roster in an email.
Oh, okay. I'll have to
So
look.
we'll be able to see it in the Unitech,
Yes, that's where everything is
Okay.
sent in your Unitech email, not to your personal email.
okay.
Everything has to be sent through Unitech for them to do tracking as well. Alice, did you get that email I sent you back?
Yes, ma'am.
Okay, so everything is working now.
Yes, ma'am.
Okay. Remember, you all have an exam that is open. Your chapter 4 exam and your chapter 5 exam is on Friday. So we have combination class on Thursday for 4 p.m. where all the classes will be combined. That is on Thursday. And the link that we have for this Zoom class will be the link that you will use for Thursday for 4 p.m. Any questions?
I think the only codes I was getting confused on was the subsequent ones.
I can't hear you clearly, Misty.
I said, I think the only codes I was getting confused on was like the subsequent ones, where you have to go and find the X or the A or something like that.
You said with sepsis,
No, the subsequent.
the subsequent coding,
Yeah, that was the only thing I really got confused on.
right? And you would use that, you know, when you code fully, if it's some other infection that's associated with it.
Yeah.
So you would code the additional codes for that. And then if you look, like I said, in the front of your ICD-10, if you look at it, like it tells you, and on that cheat sheet, it tells you and it helps you, it's very helpful with chapter 1. If it's an infectious disease or parasitic disease, you know that you're going to be in chapter 1.
Yeah.
So use that cheat sheet. It's very, very helpful. Use that accurate coding. Make sure that you're reading and going through the videos that I'm posting. Look in your e-learning. Look in that section. It's very helpful. I mean, you have your ICD-10. That's questions that's on your certification exam. Your certification exam is multiple choice. So if you know how to find the code, it's easier because you have, like 4 answers to choose from. But you definitely have to know how to find that first listed diagnosis, how to look in the index, and then verify through the tabular. You have to know the process of what you need to do to get the accurate coding. Remember, if you need one-on-one, we can do a coding one-on-one. We will be doing some coding on Thursday. So please, if you're able, have your manuals with you so that you can, go with the class with understanding how to find a code. It's going to be pretty tough in the beginning, but once you get a hang of it and get used to it, you'll enjoy it. Any other questions? Nobody don't want to talk to me. Why?
I really cool with my towel.
Misty, you just talking to me? Alexis, I'm so happy to see you. You said one little word, nobody else want to talk to me? Raven,
right.
you don't want to, Raven, I thought you were off and you don't want to talk to me either?
Go bring that back and go get the one from outside. The one from outside.
Okay, Alice, you don't want to talk? She said no. Dallas, I mean, y'all talk to me in these emails, talk to me in person, right? When you can see me.
Y'all shy.
My baby trying to talk too.
I see, that's right. I'll talk to you, baby. Look, nobody else don't want to talk to me. So are you all getting an understanding? Are the videos helpful? The information that's in e-learning, is that helpful for you all?
Yeah.
And look through the e-learning. I mean, I'm posting everything that I can find and reviewing and going through things. It's in the grade section of e-learning. You have to actually go in there and review. Read those PowerPoint slides along with the chapter. Use that for your exams. I mean, you're online, so you have all of the information to use, but just don't get the answers out the back of the book because it's not going to help you when it comes time for your testing. When it comes time to that certification exam, it's not going to help any. So just please, like I said, reach out to me. If you want that one-on-one, I mean, remember, Misty, we did it and you got a hang of it.
Yeah.
We did a one-on-one and, we went through it, we coded some things together and she was able to catch on. So do not be ashamed, do not be shy. If you need that one-on-one, I'm here to assist you. I want you to be successful. I want you all to pass that certification exam. So please, if you need that assistance, please give me a call. We can set up a time to do a one-on-one session. Remember, we are closed Tuesday for the 4th of July. We will have class on Monday and then resume on Wednesday. No school on Tuesday, July 4th. We do have class for 4 p.m. on Thursday, combined classes with all of the classes. So you all enjoy. I have all of you down. You will receive 10 points for this session. You had the 5 and, for those who participated. So we do have, you will receive 10 points. This is assigned to your assignment or wherever you would like it placed. So you all have a safe and wonderful Tuesday, and I will see you all hopefully on Thursday for 4 p.m. Bye-bye. Enjoy your evening.
Bye.
Bye.
Bye.